Hello everyone, good evening. So today we are going to talk about the screening of gestational diabetes mellitus. You can also call it GDM. So this is an important topic. So what do you mean by GDM? It is nothing but the condition in which a woman without diabetes develops high blood sugar levels during pregnancy. That means during pregnancy, the blood glucose level is gradually going to be increased. But the individual having, there is no diabetes at all, but the sugar level is increased during pregnancy. So that condition is called as a gestational diabetes mellitus. One of the major problems these days. And once GDM developed during pregnancy, they have lots of trouble. As you heard that stillbirth, big baby born. So all these are consequences. So let us know what are the symptoms and what are the causes, how can we manage GDM. So we'll talk today in this topic. So what are the symptoms? Generally results in few symptoms like, so there is a increased risk of pre-eclampsia and depression, one of the major, and another is requiring a cesarean sections. And those babies born to mothers with poorly treated gestational diabetes are at increased risk for being too large, having low blood sugar after birth, and jaundice. So these are the consequences. If untreated after diagnosis, if we are not going to treat, it can also result in a stillbirth. A stillbirth means baby is born but dead. In long term, children are at higher risk of being overweight. So there is a much more chances of obesity in that child after born. And another is there is a high risk of chances of developing type 2 diabetes. So these two, obesity, and there is a higher risk for the development of type 2 diabetes. So what is the causes for that? So cause by not enough insulin in the setting of insulin resistance. As I already told you in previous class, we already discussed in much detail about the insulin resistance. So backbone of GDM is nothing but the insulin resistance, and maximum non-communicable diseases is going to develop due to insulin resistance. Those who are absent in my insulin resistance class, I'll send the video so you can go through that. You will get much more detailed information from there. So that is the major cause. Insulin resistance is the major cause for the GDM. And one more thing, previously having gestational diabetes, those women who confirmed gestational diabetes in her previous gestational period, that is also one of the cause. Of family history of type 2 diabetes, those have family history, and having PCOS, polycystic ovarian syndrome. And as you all know that the cause of type 2 diabetes and the cause of polycystic ovarian syndrome, that is called as PCOS, And all these conditions, all these diseases and conditions, what we can call, and the major and central cause is nothing but the insulin resistance. So we have to focus on insulin resistance. If we are focused on insulin resistance, we are preventing lots of complications. We are preventing lots of complications for the individual. So how could you diagnose whether there is a GDM or not? By doing a blood test. For those at a normal risk, a screening is recommended between 24 and 28 weeks of gestational period. Nowadays, doctor, they are prescribing urine sugar in every visit. That is also one of the good to find out whether there is a GDM or not. But those having risk, so we are going to measure the blood sugar in between 24 to 28 weeks. That is the good time in gestational period. For those at high risk, testing may occur at the first prenatal visit. But the good thing is that every doctor, every clinician, gynecologist, they are prescribing the test. At least blood sugar should be done, or urine sugar, they are preferring in each and every visit. So that is good things. So those having high risk, first prenatal visit, we have to do the test. So once confirmed GDM, we have to go for the further treatment during gestational period for the prevention of complications. So what are the preventive aspects and treatment pattern in the case of gestational diabetes? By maintaining healthy weight, if there is excess weight gaining process is there in gestational period, that is also one of the sign. So keep in your mind, if the weight is drastically going to increase, that is also one of the sign. So first thing that we have to maintain healthy weight. So my advice is that before planning, we have to go for healthy lifestyle. We have to choose a healthy dietary pattern. We have to follow regular exercises and physical activity. According to your height, if there is weight, your weight is maintained, then you can go for planning. And then get advice from your doctor, gynecologist. So that is one of the major preventive aspect. So by maintaining a healthy weight, so there is two ways to maintain a healthy weight. One is dietary pattern, another is physical activity. As I already told you in insulin resistance class and previous diabetes mellitus class in so that is the way, that is the first line of treatment. So maintaining healthy lifestyle through our dietary modifications and physical activity. So that is the first line of treatment. So as I already told you, exercising before pregnancy. So before going to planning, we have to do healthy lifestyle. We have to maintain healthy lifestyle. Treated with balanced meal, exercise, and possibly insulin injection. So why we are going for insulin injection? If though we are unable to maintain the glucose level within the narrow range. So if we are not going for insulin injection, so what happens? As I already told you, the consequences will arise. So that is the later one. If through the dietary modifications through the physical activity. Though we are unable to maintain the glucose level, then we can go for the insulin injection through the advice of gynecologist or clinician. And breastfeeding is recommended as soon as possible after birth, once delivery occurred. So go for breastfeeding. And these days, in modern female, they are not going for breastfeeding. That is also one of the consequences. So breastfeeding keeps her from psychological thinkings, and they will maintain their healthy weight and lifestyle. So, and they're also going to maintain the child's health. So breastfeeding is advisable these days. So they are highly recommended for breastfeeding as soon as possible after birth. So if I'll talk about the screening of gestational diabetes, as I already told you, in between 24 to 28 weeks of gestational period, pregnant women, those who are not identified as a having glucose tolerance, for those women, we are giving 50 gram of oral glucose load. Measure venous plasma glucose at 1 hour. Once you give it oral glucose, 500 gram within a 300 ml of water, dissolve it and give her to drunk. After once completed, exact 1 hour, we are going to get the sample. That is the first sample. If glucose is equal to or more than 140 mg per deciliter, just see here, right? If glucose is equal to or more than 140 mg per deciliter, if you are getting the results like that, then perform glucose tolerance test. Glucose tolerance test, GTT. As in previous classes, I already told you, glucose tolerance test is for those who are suspected for the diabetes. Those who already confirmed, there is no need of GTT, also called as a OGTT, oral glucose tolerance test. So this is the test for the initial diagnosis. This is not the test for the prognosis. So diagnosis of GDM perform in the morning after 8 to 14 hours of fasting. So fasting is mandatory here. Then measure fasting venous plasma glucose. Those who are absent in my GTT class, glucose tolerance test class, I'll send you the video. You can go through that. You will get much more information there. And then again, give 100 gram of glucose orally. Then measure plasma glucose hourly for 3 hours. In the case of your pregnancy, we are going to prefer and we are going to get the sample of interval of 1 hour. But in normal GTT, I told you we have to take a sample 0 hour, that is fasting sample, and then half an hour sample, then 1 hour sample, then 1.5 hour sample, then 2 hour sample. But the better practice in GDM in during gestational period, we are going to prefer 1 hour of interval. So we are going to get the 4 sample here also. One is 0 hour, that is fasting sample. then 1 hour simple, then 2 hours simple, then 3 hour simples. So we are going to measure simultaneously. We can also get the urine for as I already told you that our renal threshold of blood glucose is 180 mg. So if the blood glucose exceed 180 mg per deciliter, then you will get the glucose in urine. That's what for the cross check we are getting urine sample also. So measure plasma glucose hourly for 3 hours. At least two value must exceed the following. If results are normal in clinically, suspect situations repeat during the third trimester. We perform, but the result is suspected. We are not getting confirmed results. So again, we have to repeat the test during third trimester. So in suspected case, if your question mark is not becomes in full stop, so there is a chances. If you get the value like that, again we have to repeat the test during third trimester. So this is all about the GDM. Nowadays, prevalence of GDM is too much high, and those who confirm the diabetes mellitus in pregnancy, so those baby who born, there is a higher risk of development of obesity and diabetes mellitus. So we have to maintain healthy lifestyle. If the individual is overweight, so they have to first decrease their weight according to, they have to maintain their body weight according to their height, then only they have to go for the planning. So this is the my recommendation through physical activity and dietary modification. This is the first line of treatment, not only GDM, but also insulin resistance and diabetes mellitus. So now I'm going to uh, talk about another topic.
Excuse me, sir. Hello.
हजुर भन्नुस् त
सर यो के भन्छ मदरलाई डायबिटिज छ, गेस्टेशनल डायबिटिज छ, अनि बच्चामा चाहिँ ग्लुकोजको लेभल कसरी लो भयो सर? बच्चालाई पनि हाई हुनु पर्ने सर?
के भन्नुभयो, मैले आवाज क्लियर सुनेन।